Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Every medication used in medical practice, and even those bought over the counter such as paracetamol, have potential side effects. They all have beneficial effects as well. That's why they're used, recommended and prescribed, but everything potentially has side effects. What's important is that not necessarily everybody gets those side effects. In fact, most people don't. And the reason for taking any medication and continuing to take it where necessary is that the beneficial effects outweigh the side effects. So that side effects are a potential doesn't mean that you as an individual person may necessarily get them. Likewise, not every medication works for everybody. People can be prescribed a medication for blood pressure and it doesn't lower their blood pressure and therefore they need to go on to something else. Article published this week on MJA Insight, too much side effect information reduces medication uptake. And I'm going to quote, evidence suggests that long lists of side effects on patient information lists do not improve informed consent, but instead decrease consumer willingness to take medication. I'll continue. This is also, quote, informed consent is central to Western medicine and sharing medication side effect information with patients is viewed as core to patient autonomy and shared decision-making, end quote. Same thing applies with surgery. Before anybody undergoes any medical procedure or surgery, they do need to be informed of potential risks and side effects because nothing that happens in medicine is entirely risk-free. In fact, it could be argued that nothing we do in life is risk-free. For those of you who've ever had any medication, and again, this includes over the counter, there will be a list of side effects. Now, what's interesting is that they can be contradictory. So you will find that on the list can sometimes be diarrhea and constipation, wakefulness and sedation, increase in appetite and decrease in appetite. And you sometimes got to ask the question, well, that such an effect occurred while somebody was taking a medication, does it mean it was caused by it or did it just happen at the same time? However, with a fairly famous exception, which we won't go into here, people can only be prescribed and will only take medications or indeed undergo procedure. And look, there is a couple of rare exceptions as well. With informed consent. Nobody can be forced to take, typically, any medical intervention against their will. In a sense, it's stressed there are a couple of exceptions. So this work was done investigating how consumers respond to being informed about different numbers of side effects and were told about a fake medication and given either a small or larger number of side effects. The conclusion, and again, the link will be at the bottom for those who want to go and read it. Overall, quote, the evidence suggests that long lists of side effects do not improve informed consent, but instead decrease consumer willingness to take medication, end quote. Now, is that a good or a bad thing? I'm not going to express an opinion here, but I think the conclusion is an interesting one. It's more or less suggesting that consumer medical information should be reduced, and that's quite going against the trend over the last probably 2 to 3 decades that says that people do need to have informed consent. We don't want to be hiding information from people. Again, we've seen a little bit of evidence of that in different circumstances, but typically as a private doctor as against a government body, people do need to be informed of benefits and risks. And that there are risks or potential side effects doesn't mean that a person is going to get it. But it's a very, very interesting that there's now a view emerging that if people are given information that, that may reduce their compliance. That suggests to me that the benefits and the reasons for using the medications are probably not being sufficiently conveyed, or that the context that, yes, these are the potential side effects, these are some of them, it doesn't necessarily mean that you're going to get any of them. And what matters is, are you getting the benefits? So to get back to the blood pressure example, if your blood pressure is coming down and you're not getting any side effects, then that there's a potential list is of interest but not applicable to you. Conversely, if you are getting side effects, whether or not your blood pressure is coming down, and if those side effects are problematic, you may need to go to something else. And clearly, if it's not treating your blood pressure, and we know that nothing works for everybody, then you need to change. People are increasingly literate. Dr. Google is a thing. because it's on Google doesn't mean that it's right, doesn't mean that it's always wrong either. What matters the most, and what we have lost track of a little bit in a one-size-fits-all world, is that individuals are just that, individuals, and can and do respond differently. The question is not, does a medication have side effects, and if so, what? It's useful to know that and recognise them if they occur, recognising that symptoms may occur that are unrelated to the medication, and there's also a simple way to find that out. You stop it, the side effect goes away, and you start it, and it restart it, and it comes back. Pretty much answers your question. If it's coincidental, it won't. What matters is for the individual, not a double-blinded placebo-controlled trial, but for the individual, is the medication that you're taking doing what you want it to do and the reason it was prescribed, and is it doing so without causing you, the person who's taking it, problematic side effects? If the answer to that is yes, then you would continue to take it for as long as those two requirements are satisfied. If that is not the case, then you can look to stop or change, and necessarily this is a discussion to have with your doctor. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like, and share. You can also follow it on all the socials. There'll be new content uploaded each week.